Good afternoon, everybody. How's everybody doing? We know we're the last group before your break, but thank you for sticking with us. We're so excited to tell you about the opportunities we see in blockchain and healthcare. I think we'll start by having each of us introduce ourselves. Why don't you start, Emily?
Sure. So, hi, everyone. I'm Emily Vaughn. I'm the Blockchain Product Development Director at a company called Change Healthcare. I'm a long-time, blockchain industry girl. I got started here in the Bitcoin industry in 2013, and so it's been an interesting journey that led me to enterprise healthcare. But Change Healthcare is a really fascinating company. We're one of the largest healthcare software companies in the United States, and we're responsible for processing about 2/3 of the insurance transactions, health insurance transactions that happen in this country. So as far as being a market-leading technology company, we check a lot of boxes, and then last year in September 2017, our CEO made a big initiative to begin incorporating blockchain technology into our business and into our clearinghouse. And we launched our first blockchain product into production in January as a private blockchain network that exists alongside the claims process. So we've made a real commitment to this tech and to this industry, and I'm really excited to be a part of this movement.
Awesome. John?
Hey, John Bass, founder, CEO of Hashed Health. Hashed Health is a healthcare innovation firm focused specifically on blockchain and distributed ledger technologies to solve the drivers of the cost of healthcare in the United States and globally. We are most known for 3 products that are in the process of going to market. One is called ProCredX, which is basically like KYC for physicians. It's all around the credentialing of physicians, which isn't super sexy, but it's a big problem in healthcare. Another project that we're working on is called Bramble. It's a decentralized health services marketplace where we're using non-fungible tokens to represent healthcare services, unique healthcare digital assets that are sold on a decentralized marketplace. And then the third project is a value-based contracting solution for value-based care. And we've got a queue of other projects that are kind of behind those, but that's where our focus is today.
And I'm Carlos Bustamante. I'm chairman of the Department of Biomedical Data Science at Stanford. It's a department we began 3 years ago to essentially think about the big data problems that we face in healthcare delivery as well as in precision health. Precision health is the name we've given to our strategy as an organization to predict, prevent, and cure disease precisely, with the idea that data needs to be brought to bear on the massive cost of healthcare. In the United States, we spend nearly 20% of our GDP on healthcare, and in many ways it's not really healthcare, it is sick care. It is an extraordinarily expensive and interventionist system that often steps in way too late. And so our thinking as an organization is that we need to move far more in the direction of preventative medicine and the opportunities that lie at the intersection of data streams coming from healthcare organizations such as Stanford, which is a provider, payers who ultimately hold the purse strings on how healthcare is paid for in this country, oftentimes administering programs for self-insured providers, and obviously patients or consumers who, in my opinion, hold the keys to what is going to happen over the next decade. If I think about the data that we'd like to have at Stanford Hospital in 2025, 95% of it hasn't been generated, and most of it will come in the door with our patients. And so the degree to which we can get ahead of the curve and begin to think about preventative care that keeps people healthy, it almost seems like a truism. It almost seems like a very extraordinarily obvious and obvious thing to do, which is keep people healthy in order to prevent disease in the future. But it's extraordinarily difficult. And so excited to be here with you guys thinking about these issues.
Yeah.
Maybe we could start by thinking a little bit about what you guys see as the biggest pain points in healthcare delivery and including payments and how blockchain can help.
Sure. So, there are a lot of pain points in healthcare delivery, and I think that one of the glaring ones that you have to look at in the United States market is the rising cost of healthcare. Today, healthcare represents 20% of our GDP, and it's expected to increase by another 3 to 5 trillion over the next few years. And if you consider what that cost is, it's pretty unsustainable from an economic standpoint. And then you have to look at what contributes to the rising cost of healthcare. And there are many things, and there are many different areas that you can focus. But one area that we've been looking at is the cost of administrative overhead is representing 30% of that cost for the entire industry. And so when I joined Change Healthcare, and we're looking at both how can we innovate at a network infrastructure level, how can we redesign applications to be more efficient and more effective. You could really just summarize the goal of our blockchain investment as being the elimination of data reconciliation. If we could just get to a system in which we didn't have to reprocess information that we already agreed on, we believe that we could capture enough efficiency to really open the door for not just blockchain, but other decentralized technologies as well.
So I'm curious, at Change Health, I think you guys handle a massive amount of the insurance claims in the country, is that right?
Yes.
Give us a sense of how big that is.
So yeah, we're looking at 2/3 of the U.S. healthcare insurance market. That's about 3 trillion in claims volume annually that flows through our system. We represent end-to-end payment integrity solutions for 95% of the top insurance plans in the U.S. And so for us to be taking a blockchain-based network solution, not just for improving insurance products, but just information exchange and value exchange, we're confident that we can implement these solutions at scale and hopefully in a fast enough timeline that we can be proactive about combating the rising costs of healthcare rather than reactive to some sort of crisis scenario.
So is the idea, just to help me understand, is the idea that, say, smart contracts will be able to embed within them the details of benefit plans so that you don't have as much back and forth? Is that one area, or are there other opportunities that you see as bigger pains?
Well, yeah, sure. You have to look at the whole spectrum of what blockchain technology means now. You have distributed ledgers, you have token technology, you have smart contract technology, and all of these come together to impact how we design and build and deploy applications. And so, I guess I'm speaking quite broadly, but when you look at the insurance process, you could absolutely use smart contracts to create secure automation in the claims lifecycle. And in our product that we have today, we're simply just recording the claims lifecycle events as they come off of our clearinghouse and providing a sort of a view into that lifecycle data through the blockchain via an API, but that's just the beginning of what a network like this could do. Once you begin to capture event data off of a claims workflow, that can be leveraged into any number of applications that can make it easier for businesses to collaborate. So I think of what can the distributed ledger do itself to create data provenance and a proof of existence of around where information came from, who created it, and what did they do with it. And then looking at token technologies to change how we collaborate in a financial settings, and looking at smart contracts just in general about how that they can improve automation, not just in the payment life cycle and in the claims process, but also in AI and in the other highly data-driven areas that we've been investing into.
Absolutely. I mean, one of the areas I'm most excited about is the health coin idea, right? So if we think about a patient today, how do you incentivize that patient to stay healthy or to adhere to a medication treatment plan, right? 30%, 40% of medications either go unfilled or unused. We were talking backstage about cardiovascular disease risk, which is still the #1 killer in this country, cancer right behind. If you could verify that people are on their statins, taking the medications they should be taking, doing the exercise that they should be doing, that data stream has tremendous value. And you can imagine scenarios in which those data streams get resold into reinsurance plans that could eventually begin to bend the cost curve on delivery of care.
Yeah, I think that that's exactly right. I think one of the big opportunities is this shift that's happening right now around the shift from volume-based care to value-based care.
Mm-hmm.
And I think universally we all agree that that's really important. I think part of the challenge is we've got all this infrastructure that we've built up over time that's a big contributor to our cost problems.
John,
Yeah.
could you explain, I think, to this audience what you mean by the shift of volume-based care to value-based care?
Yeah, sure. Like our healthcare system's built on a fee-for-service rail, right? So everything's about doing things to people, and it has no regard to the outcome of what you did. So the best doctors or the best, EMRs are basically billing platforms, and it's the whole system, all the infrastructure and all the payments and reimbursements have been set up to focus on transactions. And the more transactions you do, the more you get paid. And so we're shifting from that system to a system where we want to take a look at, okay, you did this to this patient. What outcome did that have? The problem is that we're finding that it's difficult to scale value-based systems because we've built infrastructure that doesn't care about the relationship between cost and quality. And so part of the challenge that we all have to deal with is how do we get to a sustainable value-based system? And so what's exciting about blockchain distributed ledger technologies is that we can have a new conversation around the digital infrastructure that's used to support these value-based initiatives. And using programmable value transfer, using even potentially cryptocurrencies and other kind of tools in this tool set, especially when you start bringing in AI, IoT,
100%.
machine learning, genomics, precision medicine, all of a sudden you've got this new rail, this new development platform that can be custom built to reflect the relationship between cost and quality. So we can build ground up
Absolutely.
value-based systems that don't exist today.
The other thing is that health care spending is extraordinarily fat-tailed in terms of the distribution. So about 1% of the claimants on the insurance rolls of any given year eat up about 22% of the pie. 5% of claimants eat up 50% of the pie. Mm-hmm. And in an homage to Pareto, the top 20% eat up 80% of the pie. Meanwhile, the bottom 50% eat up almost none of the pie. Mm. So in the United States, we literally spend $10,000 per man, woman, and child in this country in healthcare, yet half of Americans spend less than $1,000 a year.
And I'll tell you, the same trends around escalating costs and variable quality exist everywhere around the world. I don't care where you live.
Absolutely.
You look at the trend of cost versus
exactly.
GDP and versus per capita income. The trajectory is exactly the same. It's just more acutely felt in the United States because it's 20% of GDP.
In Britain, it might be that they spend, 5,000 pounds instead of $10,000, but it's the same
it's
Pareto
all
distribution.
unsustainable. So globally, we have this major crisis that's looming. And there is we're having the same conversations over and over.
Well, and part of it has to come from the successes that we see in medicine, right? What happens if we're much better at keeping people alive through intensive care? We're much better at keeping people alive after a heart attack. We're much better at averting cancer. People live longer, right? And a lot of healthcare costs actually come towards the end of life. So one of the fascinating things that we've seen at Stanford is that through AI, we can actually mine the EHR data and predict who the most expensive patients are going to be next year and what are the deployment of service lines that can help us, improve on those outcomes. And it shouldn't surprise you, you don't probably need to be an AI wizard to figure out that palliative care, that is end-of-life care, more than pays for itself, right? You begin to deploy that earlier in the cycle, and you get to much better outcomes, right? 80% of people say they would rather die at home surrounded by their loved ones than die tied up with 80 million tubes coming out of their nose and their mouth, right? But we don't have those conversations.
That's right.
And I actually think blockchain could be a very interesting approach, right? You can imagine being able to embed this into a giant permission file in the sky that allows you to spell this out no matter where you're receiving care for this to percolate through.
Well, and I would even, that point is one of the reasons why I began targeting bringing blockchain into the healthcare industry, 2 years ago, which was I see the highly extensible networks that are able to engage consumers at the edge and provide a full chain of provenance of their interactions. It doesn't matter if you're one person or if you're a company. You can have this entire shared history about what's going on. And I wager that the reason that we haven't been able to engage patients directly through technology up until, well, I guess ever this way, is because it's just not economic to do so. And it's not economically viable to custom design systems for patients who have a diverse set of needs, where the people who cost the system the most are patients who have highly specialized needs. And so, people ask all the time, other than altruism, why would you want to bring, blockchain, transparency, and collaboration into healthcare? And I think that there is a legitimate business opportunity to produce highly personalized applications at scale and provide continuity of identity, money, claims, and care treatment across the entire spectrum, and to do so in a competitive way.
Look, I've talked about the fact that we need to build a technology safety net that protects our most vulnerable citizens, right? And at times I feel like I'm a crazy person, right? When I argue, no, we should be treating, our aged and homeless people in a system that has this kind of data provenancing, right? Because oftentimes, think about homelessness. That is a situation in which loss of identity often leads to loss of services, right? You lose your ID and you're a homeless person. How do you reclaim that, right? And in fact, the mayor of Austin has announced competitions precisely to use blockchain in that setting, largely because healthcare delivery through emergency systems is the most expensive way to deploy healthcare, right? So let's figure out how we can bring some of this technology to the most vulnerable people, because they are, in need of much better services, and ultimately it could save resources that are being, deployed in very inefficient ways that could be redeployed in much better ways.
And while, go ahead.
Oh no, I was just going to say. So you get a sense of why healthcare. There's trust and transparency and incentive alignments everywhere. Pick your value chain: the pharma value chain, the supply chain, the claims life cycle, medical records, which is kind of everyone's favorite use case. It's full of opportunities for blockchain. The question is, how do we get from this system that we have today, that's breaking under its own weight, to these future state platforms that can help us tackle not only value-based medicine, precision medicine, and socioeconomic factors that are driving the 20% of GDP costs. And I think that's what's hard, is getting from here to there.
Right.
Well, it's interesting, where I first heard about, some of these technologies is actually from the CDC. You don't normally think about the CDC as a particularly innovative organization, right? They've dropped the ball in a bunch of scenarios in the past, in my opinion, but they're the ones that want to get ahead of this problem, right? For emergency management, you want to talk about how do you bring electronic health records to people after a tsunami or after FEMA, for example, is also very interested in deployment of these technologies. And I think that pointy end of the spear could be the mechanism by which it begins to percolate into others.
Yeah, they've got a real problem around the ability to share data across labs. So if there's an outbreak, and it's just, Zika or something worse in the future, their ability to stop that, it depends on their ability to share information across a lot of different labs and a lot of different entities in a very, so blockchain is a great foundational tool for them to be able to react in a way that could make a big difference in terms of an epidemic like that.
And I would say that the opportunity for this infrastructure to get adopted in healthcare is very real. Healthcare infrastructure across the entire industry is fragmented. It's contextualized to the value chain. We talk all the time about there being an opportunity for the healthcare industry to leapfrog other industries in its adoption of blockchain, because in many cases there's not a system in place to replace. So truly the digital standard for processing claims is EDI. We're only now, in the past few years, starting to adopt API technology in healthcare information systems. So when you think about re-architecting these types of business dynamics in a digital ecosystem, API emerged as a way to kind of re-architect these point-to-point communications that come off of the way old school server technology works. And a blockchain is a network that actually could make it a lot easier for a company to maintain one-to-many connections. And the CDC is an excellent example of that. People don't necessarily remember that it's the Centers for Disease Control. So the CDC is a consortium of nodes that are all collecting data independently
100%.
About the citizens in their ecosystem, and they have to share that data and report it under different circumstances. And sometimes it's one-to-one, sometimes it's one-to-many, and it's just a fascinating model for when and where you need to share data.
Well, one of the things I'm most excited about are actually community-owned databases and resources. So in my area, my other hat I wear at Stanford is I'm a geneticist, and I run a lot of our work on population and human genetics. And in the rare disease world, genetics has just been transformational, right? Over the last decade, the ability to rapidly and efficiently and accurately sequence human genomes has allowed us to solve often 30 to 40% of the unknown disease cases that come into a clinic. So a child shows up, they've got failure to thrive, or they've got intellectual disability, or they've got a whole number of symptoms. We can often use genetics in conjunction with their medical information to diagnose what the patient has, and not often, but sometimes actually come up with ameliorative therapies. As we think about the rare disease world, though, the big challenge that we're coming up against is that the cost of bringing pharmaceuticals to market to address those rare diseases is often insurmountable.
And you do make it through that, and then for a lot of these new therapies, there's no good way to pay for them.
Well, that's exactly right. So Spark Therapeutics, wonderful company out of CHOP, the Children's Hospital of Philadelphia, they have literally a cure for blindness if you happen to be one of 2,000 kids who are born with a particular mutation. So if you're one of those 2,000 kids, they can literally cure your blindness, and it costs $750,000 a year, right? So you're in this catch-22 of how do you solve that problem? Well, if you're part of the community that donated data that got used to find those cures, shouldn't you be getting it at the lowest price possible?
Right. Well, and then in another way, why is this so expensive in the first place? Because it costs them so much to develop the treatment to get to the point that they're in. And that's where I think...
Well, because many fail, right? So because so many drugs fail, you got to place 20 bets, right? It's like a hedge fund, right? You got to place... of the 10 bets you place, one really pays off and has to recoup the cost for the rest.
All the rest.
So
well, you also have to think about like the success of that product for a patient, the value of that product to a patient. Like for cancer drugs, a lot of times it depends on the patient, the site of care, who's delivering the care, and And so, like what type of tumor you have and the stage of that tumor in terms of the value to you. So if you're talking about value-based care for genomics therapies for cancer, it's all about that patient and the provider. And so, how do you tie reimbursement to value? You can't do that in today's world. You have to create a way that looks at the characteristics of the patient and looks at the performance of that drug over time and does basically programmable value transfer based off of that shared source of truth around the performance of that product. Otherwise, it's going to be really hard to get paid for these types of orphan drugs that are coming to market.
You know, the other thing that's fascinating, when you think about who pays for healthcare in this country, it's largely a combination of the federal and state governments through Medicaid and Medicare, and self-insured entities who are the large corporations. So since the Truman administration, if you're a company of a certain size in this country, you are obligated to pay for the health insurance of your employees. Those self-insured entities have a huge vested interest to break with the nonsense that is healthcare delivery today, right? When you look at the JP Morgan, Amazon, Berkshire Hathaway nonprofit, they've got 1 million covered lives. They want to come together, figure out how to analyze those data together. The opportunities are massive. So I think we're in for a decade of disruption with blockchain and AI, in my opinion, at the center of that transformation.
We have to create markets that are focused on competition and choice and value. And it's going to be tough to do that unless we have a fundamentally different way of looking at the foundational infrastructure.
Great. Well, we're getting the time's up message from our backstage host. Thank you so much for sticking with us. We're on for a break and happy to stick around and answer questions folks may have. Thank you so much.